Thank you for joining us today for the Oley Foundation webinar, Notes from a Plumber's Helper, Clogs I Have Known. This is a supplemental question and answer session. We are joined now by Dr. Manpreet Mundi. Dr. Manpreet is the Medical Director for the Home Enteral Nutrition Program at the Mayo Clinic in Rochester, Minnesota, and a new member of the Oley Board of Trustees. Dr. Mundi is coordinating research that tests the flow rates of enteral feeding tubes and connectors. He is here to answer a question on clogs related to ENFit connectors. Dr. Mundi, the question that has been presented to us that we're hoping you can lend some insight on is, do you have any advice or thoughts on how the 2.9 millimeter diameter of the ENFit connectors will affect tube feeding and clogs?
Absolutely. Thank you for having me. And it's a great question. The short answer is at this point, we don't know. A little bit longer answer, just to explain to everyone what ENFit is. ENFit is a new standard that's being adopted for enteral nutrition. And this came about really because for years we were noticing many complications arising from misconnections. So if we look at literature over the decades, there's been more than 100 cases reported of misconnections, meaning enteral supplies being connected to IV or other access devices in a patient. Out of these, there's been at least 21 reported deaths. So with this, years ago, industry in partnership with many major organizations came with a new standard that would only allow enteral supplies to be connected to enteral access devices like PEG tubes or PEG tubes. And this standard has been called ENFit. So this transition is happening. It's happening slowly because as they were rolling out the design, many issues began to arise, including medication dosing. We also, our group, started noticing that much of the data that was there was appearing with pump feedings or feedings you may typically do in the hospital. So our group, with the help of Oley, was able to then work with GEDSA, who's the major manufacturers behind ENFit, and allow us to test ENFit for patients in terms of home enteral nutrition needs. So what we felt was that the way we could start this testing would be to start by doing gravity flow testing. So simulating how a patient may do gravity flow using ENFit and comparing that to the legacy tubes. We've finished this data, we finished the testing and also are analyzing the data right now. So I don't have slides to show you, but the data is quite mixed. It's really showing us that it depends on what tube you have currently, whether you will have an improvement in flow rate or a reduction in flow rate after switching to ENFit. And again, also, it will depend on the type of tube that you switch to when you go to ENFit. I'm hoping to tabulate all of this data and have it for presentation at the National Oley Conference this summer. But for now, what we're finding is that if you're doing gravity feeds at home, you will see an impact, and it could be good or bad depending on what tube you're currently using and what tube you're going to with the ENFit system. So that's flow rate. We've also done testing for those folks who do blenderized tube feeding. So we've done testing in terms of the force it takes for you to provide the blenderized tube feeding through the ENFit system and comparing it to the legacy system. And we're also getting very similar results. Although those results I can't even speak on because our statistician is helping us analyze some of that. So, right now I'm not able to answer your question fully, but our hope is to have all of this ready for presentation and then really question and answer session by this summer when we have the National Oley Conference.
Great. Thank you so much, Dr. Mundi. And I should add that the Oley conference will be July 5th to 9th at the Hyatt Regency in Old Greenwich, Connecticut. For more information on the conference, go to www.oley.org in the annual conference tab. Thanks again for joining us, and have a great day.